Welcome to Martino TV. Here's an eye. It may sound graphic, but do you know that most Lasik surgeons are using blades to cut a flap in this part of the eye and then to work on it with the laser? Now, that doesn't mean they're reckless or anything like that, but they can never, ever be as error-free or as perfect making that cut as they can be with a special bladeless technology. Dr. John Dishler is here to tell us why he uses this technology and what the old technology is all about.
Thank you, Tom. Thank you. Yes, so starting about 15 years ago when we first started doing LASIK...
You know what I want to do? Your mic is on the inside there. I just want to move it to the... I'm sorry. Live TV. There you go. It was getting...
after all this time, I know how to
It was getting that little rubbing noise.
I know how to operate on eyes,
all right.
But, you know,
Now let's talk about that flap and what you do, and tell me the old way.
So the old way, and you know, one picture's worth 1,000 words, and you can see these are all the little pieces and parts that are necessary for doing it the old way.
Now hold on.
There's a
what
motor.
Are we looking at? Pick that up so they can see it.
So there's a motor that is. This is like a little shaver. There's a motor.
Hold on.
And there's
right there. Here.
And there's a little cutter head here.
So it's like a little shaver.
It's like a little shaver.
And it goes in a circle.
And it goes across the eye and cuts the front and makes a flap.
So you go like this.
Here.
Zip.
It attaches and it goes zip back and forth like that.
And it shaves, literally.
Yeah, and here's the razor blade that it uses. It uses actually a little razor blade.
Okay.
So it's just like a little when you go to the barber, like a barber clipper.
Gotcha.
Okay, a miniature barber clipper. This technology is based on stuff that was developed 50 years ago, and still half the LASIK that's being done today, the first step is using this razor blade across the eye to make that flap.
Now, the problem with this is it can never be as accurate.
Never be as accurate as an all-laser method. So the next step was the intralase, which used a laser, and this little Sputnik-looking thing...
Where'd that go on the eye, even though it's not to scale?
This touches the front of the eye like this.
Okay. And then what?
And the laser beam comes through the center, scans across the eye, and cuts the flap.
Oh, that's
going
good, huh?
right through this little...
Is that good?
That's good. That's a huge, huge improvement. Started using this about 7 or 8 years ago. Okay?
Dr. John Dishler, by the way, our expert.
We were the first ones in the U.S. using this technology.
Okay.
Now it's everywhere, and about half the LASIK being done is using this all-laser method.
Is that what you use?
And we still have this, and we still use it, but we have something even better.
Okay, what's the better way? The newest, the latest?
Is the latest, the newest is called the VisuMax, and here what's done is this disposable device. If I can pull it out of here. Now, this time, this little plastic thing...
Now, show the plastic thing there to the camera. Okay, there. That goes over the eye.
That goes over the eye like the other one did.
And then
what? See that?
Yeah.
And the laser beam still goes through the center, but this is curved on the front.
Okay, so hold that still then. Okay.
It's got a curve on it, so it's like a contact lens. So rather than having to press the eye flat, you can see this thing was sort of halfway in between the new technology and the old technology. This is sort of transitional.
Okay, so what does this allow you to do?
This does two things very importantly that doesn't do. One is because it's curved, it barely has to touch the eye.
Okay.
So it's all done with there's no pressing or grabbing.
And a flap is then made with the laser.
And a flap is made with the laser through this little window in the center. And it's very, very accurate because this scans the eye before it starts and knows exactly where it is. So it's very, very precise, much more precise than anything else.
Now, people might ask, and here's you actually doing it, okay? People may ask, why do you even need a flap? People, what they do not realize is the laser correction is done underneath the flap. Why is that?
That's because we're kind of tricking the eye. We can make this little flap, do the laser correction, put the flap back, it heals overnight, and by the next day, people see really well. Their eye feels fine, and they go back to their normal activities, as opposed to the older way, even older than this, of doing laser correction, where the laser's done on the surface, PRK, so to speak.
But what's nice about this is you're laying there, and no one is really touching your eye with anything. You just they simply rest that there.
You can see on the video, this thing just barely just touches your eye, and the eye's numbed up with drops, so there's no sensation at all. There's no pain, there's no discomfort, and this whole process, the scanning, everything only takes about 15 seconds. So this flap is made very, very quickly, and this is the important message. This is the important first step. As this part of the procedure goes, so does the whole procedure.
Now, making an accurate flap is the entire in the entire secret of if you don't get that right, the rest of it, done.
Right.
Now, you need both, all right? But you got to get that flap right. Okay, now, most injuries and problems happen with the hand-cut flaps.
Right. And the hand-cut flaps have to be, because they're so risky to do, they have to be made much thicker than we can make them with this.
Right. So
that means new people that used to not be candidates for LASIK can have LASIK now, because this thing can grab onto any eye, whereas this old device, some eyes it wouldn't work. The old device could make holes in the flap, tear the flap, do all kinds of nasty things. This, much, much safer.
All right, so let's talk about why other people don't use it, or why it's not widespread.
Well, it's at several big research centers. It's a very, you can see the picture of it here. It's a very fancy, very expensive device. Yeah. We've been involved with this company, Zeiss, who makes great optics, and we've done some research with them.
So what is a machine? What is a machine like that?
This machine is over $500,000.
What?
Yeah.
Oh.
So it's very expensive. Whereas this, with the blade, is, you know, $10,000, $20,000.
Wow.
So a doctor, you know, unless you're really involved in this, you know, this is a very expensive, big, you know, commitment to make to this. But it's important to have the very best, because...
Let's talk about this, because so many people question what you do. What part of the eye are you working on?
Well, yeah, we're only on the outside of the eye. We don't go on the inside, which is where the lens is. No, we're not doing cataracts. We're not operating on the...
You're only working on this.
We're only working on the outside. And then we're making this flap with this laser that's very, very thin.
Right. So that's the entire procedure right there, within seconds. And you have lasers that can do a lot, and they can do a lot of correction in a short amount of time. Laser makes the flap in seconds. Bladeless alternative, of course, to these tools we've just seen. It's precise, very thin flaps with predictable outcomes. They're consistent, which means that some people that were not candidates are now candidates. Also, the treatment is customized and computerized by Dr. John Dishler for each patient. And you retain your sight through the whole procedure. There's never a time where you're blacked out or anything.
Right, very important.
And you can see immediately after surgery. Here's the special we have. We call it the $395 anniversary special. Dr. John Dishler's been with us for more than a year now. We're so proud of him. We've sent so many people to him. New patient LASIK exam. It includes a consultation, aftercare for 1 year. No extra charge for that custom bladeless technology you've seen. 0 down, 24-month financing for some. And you just have to call for details on that. And we're extending this offer to the end of the month. Dr. John Dishler. And when you call... Tell him you saw it here, 303-793-3000, 303-793-3000, Dishler.com, $395 off. And I should say, the already guaranteed lowest price for the same technology and same correction. We're very proud of our partnership, 303-793-3000, Dishler.com.